Cervical myelopathy has a constellation of symptoms. Many different disease processes can cause this disorder. Dr. Silvio Hoshek of Desert Regional Medical Center in Palm Springs discusses this disorder and the treatments being offered.
Cervical myelopathy is a condition of the spinal cord which is in the neck region, so that's why it's cervical. It's called cervical, or the 7-8 bones that we have in our neck for our movements. And then of course the spinal cord is there, which is protected by the spine and the vertebral body. And myelopathy means, it's a Greek word, myelopathia, which is, pathos or diseases of the spinal cord. It's a whole realm of different conditions ranging from trauma to the neck, from tumors in the neck, infections in the neck, and also degenerative conditions of the cervical spine itself, like multiple sclerosis, ALS, those kind of conditions which are degenerative disorders. Those kind of traumas, car accidents, motorcycle accidents, falling, intoxication and falling, in a fight. You can also get trauma by just in your work, by lifting heavy stuff, and they fall backwards and they brace themselves, and they can get a ruptured or herniated disc in the cervical spine, disc section. As we get older, we also have what's called degenerative osteoarthritis. It's the wear and tear of the neck, because the neck is very mobile and very stressed. It takes you back to the days of high school football, doing the headbutts, rolling, whatever. So that's degenerative arthritis of wear and tear. And you can also have the conditions of rheumatoid arthritis, which is the rheumatic condition where there's degeneration of the cervical spine and the joints. And what happens is, anything that compromises the spinal canal and it narrows the spinal canal, it starts impinging on the main phone line, which is the spinal cord. So when you start impinging on the spinal cord, be it acute from car accident, a ruptured disc, or slowly the degenerative arthritis pressing, you now start developing what's called the cervical myelopathy. They will complain, I can't move my neck well, I cannot sleep or look around because I get the creaking and cracking noise in my neck. And then they start noticing that, I'm losing things. I cannot hold on. I cannot write. There's numbness in my hands. I drop my coffee. So that's the weakness part. So you have the sensory part and then the motor part. So it's a combination of both. The confirmation is usually with x-rays, because you can see the degenerative arthritis or the settling of the bones, or what we call the osteophytes and such. Then we usually go to what's called the computerized axial tomogram or CAT scan of the neck. You usually end up with a gold standard, which now is the MRI, magnetic resonance imaging. And then the treatment is a little bit conservative if it's not too bad. In other words, take some anti-inflammatory medications like Advil, Motrin, whatever it may be, naproxen, which is Aleve, some traction, some exercises and stuff. But if they come to neurosurgery, they more likely have been already through that gamut, through physical medicine, physiatry, and everything. So they're really coming now to a surgical treatment.